It's actually really amazing to me. Telehealth has been percolating along for decades now, but this has really just accelerated the adoption of it in medical practice, and I think in a really good way. And I think it's going to change the future of how we practice medicine. And I think it's a good thing for geriatric patients in general, because geriatric patients, I'm a geriatrician, they're often frail. They have multiple comorbidities. Many of them are living in poverty. And even just to get to the doctor is tough, and especially for someone with Alzheimer's disease. And again, their loved one, their caregiver. It's, again, I take the Manhattan perspective, but it's not universal. But, getting dressed, getting in the taxi, confusing environments, getting to the waiting room, sitting in the waiting room, all that stuff is hard for a lot of Alzheimer patients. Getting in the car if you're in suburbia or outside the cities. So I think that telehealth is a big advantage for Alzheimer patients. And I hope that going forward, especially with new payment models for telemedicine, that, this will be encouraged. And, the kind of questions that patients often ask of doctors in the care of Alzheimer patients are often about care and management. I mean, we do have medications that are modestly effective, but certainly most of the questions that I get are about care and management of patients, advice to caregivers. And I think that it can be very effectively delivered on a telemedicine platform. And when I say telemedicine, I mean, I include the old time technology that we call the phone. These cell phones really work really well. I've been talking to my patients that are sheltered in place, their caregivers. We don't have to have video conferencing to give advice. And I think I have gotten phone calls from basically stressed out caregivers. What should I do? What should I do about this? And, in the extreme, sometimes it requires medication, for agitation, for example. But I think, yes, I definitely think that Alzheimer's can be effectively managed with the advice of physicians through technology platforms.